Trauma therapy is hard for clients and for therapists. When we work with traumatized clients, we have a lot to balance. If I try to do trauma processing with my clients, will they be re-traumatized? Will they drop out of treatment? If I don't do trauma processing with them, am I colluding with their avoidance? Will they stay stuck with symptoms that they could get relief from? Hi, I'm Victoria Franz. I'm a clinical psychologist on the PESI team. I'm delighted to be here with Dr. Phil Manfield, creator of the FLASH technique, which is shifting the frame around what trauma processing looks like. Dr. Manfield developed FLASH as a solution to the problem that trauma therapy can be very painful for clients. Also joining us is Dr. Engel, Dr. Manfield's training partner, with whom he'll be co-teaching PESI's upcoming training in the FLASH technique. Welcome, both of you.
Well, thank you. Pleasure to be here.
Can you share with us some examples of what you've seen FLASH do for your clients?
Well, where do we start? I've seen OCD disappear in one session. That's a little shocking, really, because OCD is hard to treat. On the other hand, we have OCD that FLASH fails to treat, but the successes are really eye-opening.
I've had some long-term patients who've had very, very terrible childhoods, abuse, being burned with cigarettes by their parents, molested, that I've worked with for a long time with a very gradual improvement, but an unwillingness to process their trauma with EMDR or by other techniques, who became, who were willing once we learned to do FLASH. And they had a kind of hockey stick curve of going slowly up and then making enormous progress very fast.
So you've seen it help people rather rapidly, it sounds like.
Oh, I've had a lot of people who've had terrible single incident traumas, like a carjacking or a friend drowning in front of their eyes or being caught in the middle of a mass shooting. And those often resolve in 1 or 2 sessions completely.
You've trained a number of therapists already in the FLASH technique internationally. What kind of feedback are you getting from therapists who are using the technique?
Well, first of all, the number of therapists that we trained internationally is now over 9,000. And this is only in the space of a few years, because the Phil developed the technique just in 2017. So, the reason that there are so many is they tell their friends, and we've even heard recently that a number of jobs, a requirement is to have taken to be trained in the FLASH technique.
Yeah, that's recent, and it's just fun to hear that.
Mm-hmm. Wonderful.
And they tell us that they're just amazed at what FLASH can do. It's sort of amazing, and we remain often amazed ourselves.
Absolutely. We have a listserv with 3,400 clinicians, and so a lot of the feedback just comes from glancing at the posts and people saying, FLASH is what I do now. Occasionally I do something else, but FLASH is my go-to. It's changed the way I do therapy.
So you're getting feedback that therapists get trained in this technique and then kind of shift their practice to do this technique almost exclusively. Tell us a little bit about what the technique involves. What is FLASH?
Well, it sounds kind of silly when we say what we do, because we have the person identify what they're working on, the trauma, and then we tell them we don't want them to intentionally think about that. anymore. And we have them engage in something that's sufficiently distracting that they're not thinking of the trauma any longer. And periodically we say flash or blink, and they do this rapid triple or quadruple blink. And then after a half dozen of those, we'll go back and have them check in on the memory without actually thinking about it, but just touch in on it and see if you notice any change. And people always look really confused
And one of the
because
things that's special about Flash is that when Phil says identify the memory, it just means that we don't want to hear any details. We don't want them to get wrapped up in it. One patient who had been a shooting kind of thing that I saw, I knew what her mother sent her. I knew what she was coming in for. So I said, well, I know what you're here for. Now tell me about a positive experience that you really enjoy. And we didn't even mention it until we check on it later.
So this is a technique where a client who's experienced trauma doesn't necessarily have to talk about their trauma, and you're saying also doesn't really need to think about their trauma, but can have positive results as if they had processed their trauma.
Well, better, yeah. We there's a study that was brought to our attention a few years after we started teaching about Flash. Paul Siegel, a researcher, did a study where he flashed a tarantula in front of people, and half the people got to see the tarantula and recognize it, and the other half, the tarantula was flashed so fast that they didn't know they'd seen it. And
these were all people who had severe arachnophobia. They were really, really scared of spiders.
right, and they all had an exposure effect, but the ones who didn't know they'd seen the spider had the bigger effect. So they had more reduction of their arachnophobia than the people who knew they'd seen the spider. So that's really a nice explanation of what's going on with Flash. That for Siegel, the fMRI studies that he did showed that processing is impaired when people are upset and when they're aware of being scared. So basically, the conscious activation of the amygdala reduces the availability of the parts of the brain, prefrontal cortex, that actually do the processing. And with Flash, we get these distractions to be powerful enough that it has the same effect. People are not thinking of their disturbance, and that causes the brain to function more efficiently.
And in terms of what your introduction, Victoria, where you said working with trauma is hard, actually, it's not with Flash. If someone comes in and they have had some horrible experience, like some of the ones I've described, I sort of feel like, oh, great, we'll fix this right up, and it's not necessary for the therapist to go through all the gruesome details of what happened. Sometimes it's important for the client to tell their story, but if they don't need to, we don't need to hear it. In fact, for memories that have a lot of shame attached to them, we can even do a blind to therapist. Somebody says, there's something I'm so ashamed of I can't talk about it. I say, that's fine. You don't have to talk about it. Tell me about your dog and how much fun the dog is.
We do, in the webinars, we do live demonstrations. So we just say, well, first we do a practicum where everyone experiences the effect of Flash. And there's always a few people who it didn't work for. And we say, well, we'd like to do a demonstration with someone it didn't work for so we can show how to troubleshoot. And often when someone demonstrates and they're working out their stuff in front of 300 people, we say, look, you don't have to tell us the content. We'll just process this, and the rest of the world doesn't have to know your business.
So it almost sounds too good to be true, right? Like the client doesn't need to talk about the trauma or think about the trauma. The therapist gets a bit of a buffer. There's very low risk, I would imagine, for vicarious trauma without all those details being shared in the therapy relationship. Right. What evidence do you have that this works? Tell me about the status of the research on Flash.
Well, of course, we started out with no research, and thing is, once people see it happen in clients, they say, if they're a researcher, they say, I want to research this. Mm-hmm. And so for a number of years, we just got this same story from the researchers saying, well, I want to research this, but the ethics board or the institutional review board won't let me do it because there's no research on this. And
they have to be assured that it's safe to allow the university or the hospital or whatever to do it. But you need research to show it's safe. So
Catch-22. So we finally did our own studies, and I think what really broke things open, first of all, there were a couple of researchers that were so convinced that they went to their IRBs and said, look, I will personally stand behind this. I will make sure that it's completely safe. And so they got approval. And one of the researchers had a fear of, he had a bicycle accident, and then he was afraid to ride his bicycle. And Lewis offered him Flash, and that was just gone. And he said, wait, we need to do some research on this. And he had done like 150 studies before, so he was able to say to the board, look, I will make sure that this is safe.
So there are now 10 studies, a number of which are randomized controlled trials showing the efficacy and safety of Flash.
Yeah, there's another one in press that we just heard about last week. It's the excitement about this is that, in the beginning, the research was driven by us, and now it's starting to come back. We hear, oh, hey, there's a study that just got published, and we didn't even hear about it. And so that's very exciting. Someone sent me an article a couple of weeks ago that appeared in a journal on dermatology, where the person was talking about Flash. It's very exciting.
Yeah.
You shared with me a little bit about the work you're doing with COVID survivors. Can you describe a little bit of that for those who are watching?
Well, we did a study that's been published of healthcare providers who had been traumatized by the, overwhelm of COVID cases in their hospitals and the high frequency of death, which they're not used to, and the fear of getting COVID. And that study was very successful. And so we decided to do a study, which we're going to do right after this session today, of people that have had
COVID.
Okay.
Yeah. So that's we're doing 3 short webinars today with we had 600 people volunteer for this study. So they were randomly assigned to different groups, and then a month from now we do it again with the control. And
it's a weightless control way of doing a randomized control trial.
Yeah. So
The world needs a quick trauma processing technique that people will be receptive to. So it's so wonderful
and
to hear.
also scalable. I mean,
Yes.
we haven't done it with groups of larger than, well, 500's the largest group we've done it with, but they're really, we haven't seen any limit to how much this can be scaled to larger populations that have been traumatized.
So I have time for, I think, one more question. What's the story of how you developed Flash?
Well, I was an EMDR therapist. That's what I did mostly. And the problem with EMDR is people have to focus on the disturbing material before you can desensitize it. And some people are just unwilling to do it.
Mhm.
And some people, when they do it, they get flooded, they dissociate. Um, there were problems, and the way I would deal with those problems, which is the way most EMDR therapists deal with that kind of problem, is I would find a way to water down the target, make it less disturbing, process it in that less disturbing form, then go back and process it in its full intensity, but having been reduced by the processing that we'd done. And I was my go-to for that was a protocol developed by a woman in Victoria, Canada, um, and Christina Kanowski, and the technique was basically going back and forth between something positive and then the disturbing material, but so briefly and in such a peripheral way that the person wouldn't be overwhelmed.
Mm.
And I was going to be doing a presentation on that technique, and I started thinking, well, how finely can I slice and dice this disturbance and still be able to make some headway on it? And so I started having clients think of the disturbing material so briefly that they don't feel any disturbance and they don't get any image, and they come right back to the positive.
Mhm.
And my intention was just to make it palatable, but what I found was that the processing effects just ballooned. And I thought, wow, it would have been enough just to not get them too traumatized by the process, but to see that rapid processing. Telling my friends, and um, told Lewis, I told my brother David, who's up in Portland, who's a psychologist, and Joan Lovett, a behavioral psychiatrist, and they would each get back to me after 2 or 3 days, and they'd say,
Oh,
"Oh my God!" And they each want to tell me about a case they had done in the last few days. And I said, "Well, write it up. Let's publish a paper." And that that's how it got started.
that's how it got started. But then the first paper is in that form, but later on, uh, Phil realized that if they, instead of just thinking about it a little bit, if they didn't think about it at all, things went even faster. It was much easier to teach, much easier for therapists to use, and much even more painless. There's no way they could get caught in the memory the way they sometimes could with the first version. So since then, after the first paper, Flash has been just the way it has continued to evolve, but pretty similar to the way we're teaching it now.
Mm-hmm.
When Lewis says Phil realized, often it's Lewis that realizes. I say to Lewis, "Hey, I want you to see this demo I just did," and he'll say, "That's not Flash," and I won't even realize that I've made a change, and that's really how it's evolved.
It's so interesting to think about how the technique has grown over time with some tweaks and client feedback and kind of the community of therapists who were working on testing it out together. And now the research bearing out what your experience has been.
One of the advantages that people that take the webinar will have is that they'll be able to join the listserv of how many have we got on the listserv now?
3,400 now.
3,400. And there's a lot of lively conversation if they have problems, if they have victories, if they have a special interest like kids or OCD or veterans. There's threads for all those things on the listserv.
And a lot of what's changed in Flash as it's evolved has come from things people have posted on the listserv.
So hear that, folks. Join the upcoming one-day live webinar on April 8th and have a chance to become part of this community that is evolving and growing this wonderful technique. Thanks for tuning in. Phil and Lewis, thank you both for being here, and we'll look forward to seeing you on April 8th.
Great, my pleasure.